So Will, let's just talk a little bit about your shoulder today and kind of what's bothering you. So why don't you tell me what's going on with your shoulder?
The main pain is like right in the front of the shoulder. Like to me, feels a little bit like bicep tendon through the deltoid. I get some discomfort through the middle of the bicep, but not a lot.
Okay.
Pretty annoying. Like all day is just annoying. Like reaching out, reaching down, anything like up and back.
Okay.
All
so
those.
even that right there, did that?
Yeah, like that
cause
right
it?
there is like a low level annoying pain.
Okay.
If I go through any sort of rotation, internal or external, it'll go up in intensity.
Okay.
If I warm up to the point where I'm going to work out, it actually goes away to almost nothing. But then when I'm done, it comes back pretty immediately.
So you're done with your workout, you're going to get your gym keys because you're leaving. Does it start right then? Or is it by the time you get in your car?
By the time I get in my car,
home?
drive home like 10 minutes later, it hurts to like get my, like, because I'm left-handed, so I'll put this backpack on and like that hurts. And then by the time I pick my backpack up out of the car, it's already hurting. And then like making dinner, like reaching and grabbing like a pot, and, like,
Okay.
because I'm left-handed,
So even
so I
right
feel
there,
it, yeah.
you feel it in here.
Yeah.
And does it go anywhere? Does it go past your
Only
elbow
here,
at all?
no.
Okay.
Like I don't have any, like very local. And it's happened in the past. Like I kind of know what my aggravating factors are. Competed 2 weeks in a row, which is a lot for me.
Right.
It's like a big volume of exercise compared to what I normally do.
And your last competition was this last weekend, so
Yeah.
it was today's
Saturday.
what, Wednesday? So
4 days.
yeah, 4 days ago. Okay.
4 days and 11 days.
And then 11 days ago.
Yeah.
And was the competition you did the week before? Was that just a 1-day thing?
Both were 1 day things, but both were pretty long as far as volume and
Okay.
like amount of repetitions through the shoulder.
How did you feel at the first competition?
Going
was it
in,
bothering
I was
you?
fine. I was 100% perfectly healthy.
Okay.
No
and
issues.
then after that, how did you feel?
Like that Sunday I was so globally sore it was hard to tell. But
Okay.
throughout the week I knew that the shoulder problem was popping up.
Okay.
And then waking up Sunday after the second competition, I knew that the shoulder problem was like set in.
And at the shoulder competition, at the second competition, tell me kind of what movement you think kind of put you.
So I clean and jerk, so I put a bar over my head with a ton of weight. I got worked on right
How
before
much
that.
is a ton?
350
Pounds.
pounds,
Okay.
not kilos. So I got worked on briefly before that, and it felt fine.
Okay.
And
Before
then
your clean.
before the clean, and then I did a gymnastics workout, which was more repetitions at body weight,
Okay.
and it was trashed.
That
and then,
was the gymnastics workout was part of the competition.
yeah. So that was the second thing.
Okay.
And at the end of the day, I had done 5 workouts, and the last one was really heavy duty on shoulder stability, and like driving home immediately, like at dinner.
And what was it? What were the movements?
Handstand walked about 50 total meters, 10 reps of a squat snatch at 185 pounds, overhead walking lunge with 165 pounds for 30 meters, all within a span of like 8 minutes.
Yeah.
And like that's like I did that, put my gym clothes on, and drove to dinner. And by the time I got there, I was like my left arm was just throbbing.
Was it numb at all?
No, it's just
Okay.
and so like I'm left-handed, so I probably held a weight just below body weight for about 30 seconds.
Okay.
It's difficult.
And when you
but
say it's here, does it go anywhere kind of
no,
down
it's
into
like
your lats?
just a
or-
line straight over.
Okay. How about into your scap area at all? Do you get anything back
My
in here?
my trap has just felt
On.
because of this,
Okay.
but that's that's super unusual. Like I usually don't have a history of neck pain. I don't have a history of headaches or anything like that.
And have you had any since the second competition?
Just discomfort, no headaches, but like I guess what I would guess is muscular discomfort.
Okay. And have you noticed any changes in like your grip? Like when you're up in that overhead position?
No, I have no problems with grip strength symmetrically. My hands fall asleep all the time while I sleep. Like it wakes me
Okay.
up constantly. Like I'll have to like break.
Both of them.
Left worse than right, but I have to like break my hand. Like it's rigid, and I wake up and I like have to move.
Okay.
And mostly my ulnar,
And what
but-
position do you sleep in?
either on my back or on my side, and it doesn't matter. Like
Okay.
I'd probably say like 4 nights a week.
And when did that start?
That's been going on for a long time, and I don't worry because I've had a Tommy John surgery, same side, so I figured I'm gonna have ulnar nerve problems.
But you haven't had bilateral shoulder or Tommy John surgery?
No,
Okay.
not yet.
We're not going there, friend.
All right.
Okay?
Yeah, but that's the only weird, like, distal thing.
And that's only at night.
Only at
Do
night.
you ever notice it when you're maybe on the rings or hanging
No.
or anything like that? Okay.
No.
How about when you roll your lats out? Do you get anything?
I just feel better.
Okay.
Like-
but nothing radiating down or numbness?
No,
or-
like, it's super, super uncomfortable, super painful, but it's very local, and it makes sense because I use them. Like, to me, I can accept it
Yeah.
because I use it a lot.
Okay. And how about, do you have any, like at night when you say they're rigid and they get kind of that numbing feeling, are they cold?
Yeah, like ice cold.
Oh, ice cold, okay.
Like, the first time it happened, like, really intensely, I turned the lights on because I thought my hands would be black.
Okay.
It's like totally irrational.
I think
middle
we
fear.
can show them it's not black.
Yeah.
So, okay.
It's like totally irrational, like, sleep fear.
Yes.
But
Okay.
now it's just like, I know to, like, 2-3 minutes, flex, extend.
Okay.
I
So
go to
kind of
sleep.
tell me where we're going now. Like, what's the next coming competition for you? What do we need to get you back to, kind of ASAP or long term?
I don't have any competitions coming up, but this is probably the most important training block of the year
Okay.
because you really have one shot to qualify for regionals, which will be around March.
Okay.
And so for me, I'll chill until, I'll try to take about 2 weeks off. And then the training period of like December, January, February will be progressively more volume.
Okay.
And like I need to be in amazing shape like all the way through March.
Okay.
And that means tolerating more volume, you know.
Multiple times a day.
Yeah, multiple times a day just because I need to have one great workout a week for a month straight. So
And have you
it's-
been swimming?
I have not been swimming. I swam all summer and that helps a lot,
Yeah.
but I hate the cold.
Okay.
I won't swim.
Okay. And then how about driving? You get any pain with driving?
No, but I sit terribly.
Okay.
Just lean back.
Well, you have a Honda.
I lean on my door. Like I'm a terrible. Like it's terrible.
Did you change your headrest?
Yep, the headrest has changed. Like my head is up, but
Okay.
like I just completely slumped to one side.
Okay. All right.
So
Okay, great. Okay, so really one of the main things that I would do first with any evaluation is watch them walk in. And if I didn't have a chance to watch them walk in, I would definitely do a quick gait screen. Will's here for his shoulder, so it would be a brief screen just to kind of get a picture of that. We would jump in more detail with that a little bit later on, especially if we had time. But we always want to make sure when your patient arrives for an eval that you're addressing what they're there for that day. And then you're going to start to think about globally what's affecting the kinetic chain and what's affecting that shoulder. So we're going to watch Will walk just a little bit, and Dr. K and I will kind of jump in and just let you know what we look for. Just what you would look for in normal gait. So kind of the first things I would go to is what his speed is, and maybe just because it's a short distance, so we might ask him to walk a little bit faster because he is walking a teeny bit slow, especially for what his normal is. I looked at any shift that's happening. I think that's one of the things that stands out the most to me at this point, is that he seems pretty shifted, especially when you look at that anterior view. Yeah, so even in standing, you can see if you pause him, if you draw the line down, he goes in a kind of more of an S shape than, and he's definitely shifted as you look at his stance.
So his shoulder girdle is shifted slightly to his left, and his pelvis is shifted slightly to his right.
Yep. So why don't we walk just a couple more laps. We're also just going to watch and see, because he's here for his shoulder, we would be very cognizant of what's happening with his arm swing. And he's actually not doing too bad with the symmetry of it.
So I care about his hands passing his hips, and then after I look distally, I'll travel up his chain and look at his glenohumeral joints, and then also at his scapula to make sure that they're not glued to his body, to see if he's getting any rotation through his spine.
Yep. You're also just going to be aware of what's going on down below. So as his foot hits the ground, and we haven't dove really much into that, but just let's appreciate that, what you already know. So looking at his stride length and his cadence and how he lands on the floor, and just putting that away, kind of pocketing that into your memory. Okay. So we're gonna just appreciate what Will's standing posture is before we go into any movement test besides the gait. And just really looking at symmetry of his shoulders. He's not allowed to roll his eyes. And just looking at, even where your eyes start to go. And Dr. K, you want to jump in with where you're at?
So for shoulder height, I would say that his left is slightly lower. And I would say that his right shoulder is just slightly anterior compared to his left. We already talked about the curvature in his shift.
Yep, so why don't you turn lateral. So here we're just appreciating if he has a forward head posture. Looking at the curvatures that you would expect. So you'd expect a lordosis in the lower cervical spine, a kyphosis in the thoracic spine, then moving back into lordosis in the lumbar spine. So you're looking to see if he has those and if it's what you would consider normal for his body type. Right? Okay, posterior. Yep. So here I think really once we get honed in on our skills, we not only look at the symmetry of height of his shoulders, but we'll look at the position of his resting scapula. And we're trying to see in resting, does he sit in a protracted state or a retracted state? Like Dr. K had mentioned, even with gait, does one side seem like it's glued down, or if it's stuck to the body wall, or is one side necessarily maybe winging out? So those are different things that we might look at. You can see on Will that we'll see a little bit more of a defined border here on his left side versus his right side. So, but we can't really see, now that you're straight on, we're good. Okay, so just knowing that, and again, one piece of information does not tell us anything. We have to compile our information to put it all together to address what his wants and needs are and what his deficits are.
Yeah. Okay, so the next thing that we're going to look at with Will is his active range of motion. So I'm going to pay attention to the quality of his movement, his willingness to move. I'm going to pay close attention to his facial expressions and just how symmetrical his movements are. Okay?
And in quantity.
And yeah.
Right?
And yep. Okay, so can you just go through shoulder flexion all the way up for me? Good. And then how does that feel?
Initiating it hurts, like that hurts, goes away. Tightness,
Okay.
that hurts, goes away.
Where do you feel the tightness?
Up top, through my neck, here, both lats,
Okay.
thoracic spine.
Okay. Localized on the left side only
That's
right now? Or
both.
Both.
The pain is
Pretty-
only on the left, so it's like painful left, goes away. Really tight
Can't
on
breathe.
both sides, can't breathe.
Okay.
Painful on the left, goes away.
Okay, and then can you go through abduction like a snow angel?
Painful, tight. less
Pain coming.
Yeah.
Yeah.
So,
And you
right
guys
there,
notice,
it's
like, as he comes down, you'll see, as he comes back into that, last 30 degrees,
painful.
you'll see a kind of a click over. See it?
Yeah, so there's a hesitance, and he goes slower, and then his movement quality is a little choppy.
Choppy.
Almost.
Mhm.
Okay,
Yep.
so next, I'm gonna have you put both hands behind your head. Okay, how does that feel?
Just really difficult.
He can't breathe.
Yeah.
Yeah.
Okay, and then why don't you stay there, and then can you reach both arms behind your back, up your back as far as you can? There's
There's one.
left, okay, and
That
then,
hurts a little bit, but also like a good stretch.
okay. So then I'm taking note that he said that it feels like a good stretch, because that's important to me to look at when I do passive range of motion. Okay, so the next thing I'm gonna have you do is just reach across your body, the opposite shoulder.
Hurts to initiate.
Okay, and then how about when you're there? Not really though.
Just tight,
Okay, and then come down, let me see the other side.
less tight.
And much better quality of movement.
Yeah, much smoother, much quicker. Okay,
Absolutely.
okay. Anything else that you would look at right now?
Just range of motion. We would probably jump to passive range of motion, but because he's already in standing, we might just ask him to demonstrate some of those functional movements that are aggravating. because we would lay him back down and do passive range of motion maybe to maintain the quality of the joint. But in your evaluation, you want to get used to leaving the patient in the position that they're in.
Yeah, so that there's a flow. And we already know that we're going to do manual treatment on Will to help him with some of his acute symptoms.
Yeah.
But he's likely going to be lying down for part of that. So we'll do passive range of motion, assess more in depth with palpation, joint mobility, and manual treatment, hopefully pretty close together.
Yep. So maybe just one quick movement that we might do in standing is he has trouble when he's holding a sustained overhead load and a wider grip. So we would want to maybe just quickly initiate that, or really look at it and see what it looks like in relation to symmetry and what he looks like in that position.
So that's painful and restricted. I feel a tightness all the way in my elbow.
On the left.
On the left side, like through my scar.
Yeah.
Just feels tight. A little bit of discomfort, more
In
posteriorly.
the back.
So.
And really appreciating too how much effort that is with his head. That's one of the things that I notice. He has to work really hard to hold his head into the position that he's in. And then as he comes back down, appreciate that his scapulas don't slide and glide on the back body wall like they should. It's very glitchy as he comes back out of that movement.
Like getting through like what actually happened in a snatch. That rotation out of it feels the worst.
Yeah, and again, we're looking, this left side is the side he's complaining about. So again, just orientating yourself to, is there a difference between what's happening between the left and the right side?
If I keep it far away from my body and I do it really poorly, that feels better than if I actually just rotate through.
Yeah. So let's just pause it. Yeah.
Okay, so we're going to try two special tests right now. One of my goals is obviously to not flare Will's shoulder up. My goal today is to help him feel better, but also to confirm or negate my hypothesis. So right now we're thinking definitely some biceps involvement. So I'm going to take a look at Speed's test just to see if that aggravates his symptoms at all. So Will, what I'm going to have you do is just put your hands straight out in front of you. Good, and hold there, and don't let me push down, okay? How does that feel?
Just difficult.
Difficult, but not painful.
It hurt to get into the position.
To get into the position, but not with the resistance, okay? So then I might try dynamic speeds test just to see. So you're gonna stand up for me. Okay, and then I'm gonna resist your hand, and you're gonna bring up against the resistance, okay?
All the way
into elbow flexion, go for it. So that, yeah, okay. So how did that feel?
That hurt pretty bad through there. It went away, but I didn't want to try very hard.
Yeah, and one of the reasons that I'm doing this with him today is to demonstrate special tests to the class. But typically, if I would have started to see any sort of grimace with that, I'd be done. I would not continue the movement. I have what I need. There's no need.
It's a positive test.
Yep, there's no need for his tissue to suffer. Okay, and then Will, can you lie down on your back for me? So there, again, we were thinking about biceps. Okay, so now I'm suspecting maybe some superior labrum involvement, so I'm going to do biceps load 2 test. So I'm going to passively put Will's shoulder into external rotation and about 160 degrees of flexion. How are you doing there?
It hurt to initially get it, but now it's fine.
Now it's fine. Okay, I'm going to have you hold your arm here and don't let me pull.
Okay.
Hold. Painful at all?
Nope.
And then relax. So then I'd call that a negative test right now. Okay?
Good.
Okay,
Dave
so
said go.
now what we're going to try, it's called a scapular assistance test. So Dr. H is just going to help Will's alignment while he goes through abduction, some elevation in the scapular plane, and then Will, how does that feel?
Like 80% better.
Okay.
And then you would also, let's do it from the side. So you just want to kind of play around because we know that he's sitting super protracted, right? So as he goes into arm elevation, he needs to clear the space for his biceps tendon. He's not clearing it. That's why he keeps jamming into it. And we know that with imaging, with biceps tendonitis, because it goes through that sheath that encases it, if it gets any irritation, it actually gets thicker. And so if it's a thicker tendon, now he's going into it, even if his joint mechanics were even a little bit better, that tendon is now kind of on fire. So we just want to make sure, can we get him there and make him feel better? And know that maybe our job is we have to now make that scapula behave, his thoracic spine behave, but we're going to still address the biceps tendon and calm that down.